Alrighty, folks, welcome to another edition of The Healthy Way right here on Love 101 FM, the family station. Today we're talking about gallstones in pregnancy. Yeah? Now, gallstones are more common during pregnancy due to decreased gallbladder motility and increased cholesterol saturation of bile. Gallstone disease during pregnancy has been associated with increased risk of preterm birth, morbidity, and readmission as well as neonatal morbidity. Well, to help us this morning is Dr. Leo Walker, obstetrician and gynecologist on the Westminster Medical Center. Good morning, Dr. Walker. How are you?
Hi, morning. I'm not too bad. How are you?
Good, thanks. Good.
Good.
You want to add anything else to that, Dr. Walker?
I mean, that was brilliantly said. Couldn't have said it better myself.
Yeah.
Gallstones, as you said, are basically hard deposits of bile, which is often formed as a result of reduced flow or stasis, as well as a combination of things like cholesterol.
Yeah.
Now, of course, in pregnancy, one of the things which increases the risk is pre-pregnancy obesity. So individuals with a greater BMI prior to getting pregnant at a significantly increased risk of developing gallstones in pregnancy. Of course, there's also a genetic predisposition, so strong family history of gallstones increases one's risk of developing gallstones in pregnancy. Now, it's the hormonal milieu or environment in pregnancy which often predisposes individuals to developing these stones. So what we know is that in the third trimester of pregnancy, where concentrations of estrogen and to a certain extent progesterone are at its highest, incidence of gallstones increases. Seems to be from about 6 to 7% in the first trimester to around 10 to 12% in the third trimester, just simply from that estrogen component, which increases diastasis and increases the risk of developing these stones.
Are gallbladder problems common during pregnancy?
It's not common. It's certainly not something which we see quite frequent. You're either talking about, probably 1 in 10 to 1 in 12 individuals may develop gallstones during pregnancy. And of course, as I said, it is trimester specific. The truth is that a large number of these patients will remain asymptomatic. So they develop the stones and never even know that it has stones, so they will not develop symptoms. Smaller percent of individuals will develop some degree of symptoms, mostly in the form of what we call biliary colic. So intermittent pains in the right upper abdomen, and that's essentially it. Because most of the time it is something which will resolve postpartum after the pregnancy, at least 6 weeks after delivery.
Right. So say you have it and you don't know, what happens?
Well, if it's something which develops in pregnancy, the likely course is that it will resolve after pregnancy. So after you've gone around 6 weeks following delivery, most people would have resolution of the symptoms, if they had it, and certainly resolution of the stones, because these stones can pass out through the gallbladder. Is a possibility. A smaller percentage of individuals may continue to have symptoms following pregnancy. However, this is usually less than around 1% of individuals. For those who have continued symptoms, then those individuals will require necessary investigation, which usually comes in the form of ultrasound. And that ultrasound will help to confirm the diagnosis of the gallstone, as well as rule out inflammation of the gallbladder itself, which is referred to as cholecystitis. Now, certainly if that is diagnosed, then it is something which requires surgery. For those individuals who have gallstones without inflammation of the gallbladder, there's usually different surgical approaches which can be taken. Some individuals may have what we refer to as an elective cholecystectomy, meaning they remove the gallbladder at some later date, which is planned. Or they can have a laparoscopic cholecystectomy, or they have a certain procedure done where they can go into the gallbladder, look in there and remove the stone itself.
Okay. Let's talk about symptoms. What are some symptoms? Yeah?
Well, the most consistent symptom of gallstones is pain in the right upper abdomen, particularly after eating fatty meals. Some individuals may get nausea, vomiting, In severe cases of inflammation of the gallbladder, it can also present with fever and often the classical GI symptoms, the nausea, vomiting, and occasional diarrhea.
Mm-hmm.
For those individuals who have complications of the gallstones, it can actually cause something as severe as a pancreatitis, and that is inflammation of the pancreas. That is in very rare and severe cases of gallstones.
Yeah.
Majority of the patients with gallstones will experience biliary colic, and what that is spasmodic and episodic cramping in the right upper abdomen, particularly after eating meals. And it usually occurs because that stone becomes stuck in the gallbladder, and the gallbladder is squeezing and contracting in an effort to expel that stuff.
Well, let's look at prevention. How to prevent gallstones during pregnancy. Because I was reading
Right.
last night and I saw something about, gain a healthy amount of weight.
Absolutely. So the most consistent risk factor for development of gallstones in pregnancy is looking at one's weight before the pregnancy.
Mm-hmm.
So certainly the greater the weight prior to pregnancy is the greater your risk. So what they've noticed that those individuals with an elevated BMI have a significantly greater risk of developing gallstones than those individuals who have a normal BMI prior to pregnancy. So of course, if you're looking to minimize your risk, the key is to encourage weight loss prior to embarking on pregnancy, meaning having a normal body mass index, a normal weight prior to pregnancy. So diet, exercise are key.
Yeah.
That will significantly reduce one's risk of developing gallstones. Now, certainly if you have a family history of gallstones and you're genetically predisposed, there's not really much you can do about that. Those are risk factors which are non-modifiable. Those you can't change. But certainly, the modifiable risk factor, which is obesity, is something which you can address.
Yeah. And then there is you made mention of fats earlier. Choose the right fats. Yeah.
Yeah, definitely. So that's where the diet aspect
the diet
comes in.
Right.
Certainly a high fat diet will contribute to increased weight gain, elevated cholesterol, as well as the other significant morbidities associated with increased fat intake and increased BMI, diabetes, hypertension. So certainly addressing the diet will significantly reduce one's risk not only of gallstones but other significant comorbidities which can occur. In terms of in the pregnancy itself, there's really limited things you can do during pregnancy. The one sure thing you can do is for those individuals with elevated BMIs, what we tend to target is not necessarily weight loss in pregnancy. That's never a good thing. But we tend to control the amount of weight gain during pregnancy.
Yeah.
So, for example, an individual with a normal BMI, we expect them to gain around 25 to 30 pounds. For those individuals with elevated BMIs, we tend to target tends to be a little bit less in terms of weight gain.
I've seen a comment here on Facebook. This says, I had it back in 1997, I think, when doctors were on strike. And let me tell you, gallstone is no joke. I vomited until I was pink, and not to mention the pain.
Right, definitely.
Yeah.
Right. So that pain is the most consistent symptom when you're talking about gallstones, and it can be pretty debilitating because that pain will continue and continue and continue as the gallbladder is attempting to pass that stone. So it can be pretty debilitating. And as you mentioned, in pregnancy, it does pose some significant risk. For example, increased risk of preterm labor and preterm birth. Therefore, it has effects not only on the mother, but also on the developing fetus.
Can the pain be alleviated, Dr. Walker?
It is something which can be alleviated. Most of the times, it requires very strong injectable medications in the form of opioids, so things like pethidine, things like morphine. The truth is, though, it is something which can, you give these medications last for a while, and the medications wear out, the pain returns. So particularly if it's a significant number of gallstones,
Mhm.
and particularly if the patient now is moving on to inflammation of the gallbladder or cholecystitis.
Wow. Interesting. Yeah, interesting indeed. Well, I'm out of time. You want to add anything else before you go, Dr. Walker?
Yeah, certainly. So, number one risk factor for development of gallstones in pregnancy is your pre-pregnancy weight.
Mhm.
So, I would encourage everybody appropriate diet, exercise to minimize the significant risks which can develop in pregnancy, of which
Mhm.
gallstones is just one. Increased BMI, increased risk of developing diabetes in the
Mhm.
pregnancy,
Mhm.
elevated blood pressures in the pregnancy, small baby, preterm labor, the list goes on. So it's always important to have a healthy weight, healthy diet, exercise, and a healthy lifestyle in general.
Wonderful. How can we find you again?
So I am at the Westminster Medical Center. That's 1A Westminster Road, off Eastwood Park Road. And you can find me on Instagram at Dr. Leo Walker. My contact number is 876-372-3790.
Thank you. All the best. Appreciate it as always.
Yeah, man. Same to you. Take care.
Wonderful. Good one there. Yeah, quick one with Dr. Leo Walker, obstetrician and gynecologist from the Westminster Medical Center, Gallstones in Pregnancy. You're tuned to Love 101 FM, the family station. Please do stay with us.